All right. Okay, well, it's 7 o'clock, so we should probably make a start. So thank you, ladies, for getting up so early. Just for everybody listening, because of the change in daylight saving, of course, it was an hour earlier for you than you anticipated. And I hadn't realized that until about 5 o'clock this afternoon.
Recording in progress.
I was frantic. Oh, what's happened? Can you hear me?
We can hear you.
It was playing back to me for some reason. So I was frantically trying to get in touch with you and ended up calling you on Messenger and getting you out of bed.
Well, thanks for that.
We're so grateful that you did.
Well, I just think you look amazing for people who have got out of bed an hour earlier. So, all right. Well, would you like to start just by introducing yourselves, telling us a little bit about what you do in your work? I think most people will know about your wonderful books, of which I have a copy of each. Thanks to you for sending them to me. And then we'll go from there, and then we'll get questions from the participants. And I think you may have a couple of little topics you'd like to delve into as well.
Okay, I'll start. So my name is Estrelita van Rensburg. I'm South African originally. I studied medicine in South Africa and worked in academic setting for many years, mainly in infectious diseases and vaccine research. And then about 14 years ago, I came to the UK. I was working then in a pharmaceutical company in a global position, traveled around the world. And latterly, Issy and I have established our own business, and I've changed completely, and I've gone into healthy nutrition. And the reason for that was that you know, I had some family and friends that experienced real serious health issues, you know, 10, 15 years ago. And I was very interested to understand what can we do to prevent these kind of chronic lifestyle diseases. And I started reading about nutrition because it's not a subject that's really properly taught at medical school. And I was really astounded to realize how much disinformation is out there, and also what the medical community believes, what the nutritionists believe, are actually completely inaccurate. And this made me realize that, you know, there's something to be done. So basically, Issy and I were guinea pigs. We started experimenting, and that's how we came on to establishing our program, because we could see the change was just enormous, and we wanted other people to benefit from that. So we established what we call an optimizer plan, and it's basically to teach people what is the correct and healthy way to eat, and we can chat about, I'm sure we're going to chat about that quite a lot. So in a nutshell, you know, coming from being an infectious diseases specialist to actually working in nutrition, it's something that I never anticipated I would do, but there you are.
Well, thank you for the wonderful contribution you're making to the space, because we just need more and more doctors like you out there spreading this message and supporting, you know, people like me who are nutritionists and health coaches in our work as well. So really appreciate it.
Thank you.
Okay, you're not the only one who appreciates Estrelita's expertise, because my health would have been very, very different if she hadn't actually conducted the research that she had. It's not that the information, yeah, the information was out there, but I would probably never have found it. And certainly my doctor had no intention of telling me. I came to this in a very different route. I have no medical qualifications, but I am the original guinea pig for our optimizer plan. And the reason that I started it was that I'd had two sort of massive I had a massive heart problem. And prior to that, I had a very high blood pressure problem. So, which resulted in collapses, falls, fractures, all sorts of things. And, I'm a grandmother. I used to be really active. I am again. And I just thought, is this it? I couldn't believe it, that my health had deteriorated so rapidly. So anyway, when Estrelita said, I really think you should look at low carb and change your diet, I didn't know what to say. But, I was desperate because I needed to make some changes, but I didn't know what they were. And guess what? We started, and within weeks, I felt better, more creativity. And then within a few more weeks, off all blood pressure medication, which had been giving me extraordinary side effects, none of which I like. And it's been a journey, nearly 3-year journey ever since. It just seems to keep getting better and better.
Oh, yeah, that's wonderful. Can I ask a really rude question? But it's just so that people realize that they don't get too old and it's never too late to make these changes. Would you mind just telling us how old you both are?
Yes, I'm 61.
And I'm 71.
Great. And you both look absolutely amazing. So I think that's really confidence building for people.
Yeah. Can I just, yes, sorry to interrupt. Can I just actually on that particular point, people usually at my age actually are starting to go downhill. They may not actually identify that, but they know that they're slowing down or things are not, working so well. It is, what you said there is so true. It resonates with me. It is never too late. Never.
I think so the nature of this disease, what we're talking about, insulin resistance, which is a metabolic disease, is something that most people don't realize they have, because it develops insidiously and you're not really aware of it. And only when, one's body become quite insulin resistant, will you present with certain diseases that's then diagnosed later in life, whether it's type 2 diabetes or high blood pressure. Many cancers are linked to that, Alzheimer's disease and so on. But, there is something that we can do about this by just changing how we eat, and we can revert the basic metabolic marker that's underlying insulin is really high insulin levels. And by changing what we eat, we can actually impact that and lower our insulin levels, which will always be helpful no matter where we are in this process. Some people are lucky because they can completely reverse the condition.
Yeah, and I think that's a message that is well worth getting out there. But a lot of people are quite nervous about it because I think, like you touched on in your introduction, they're getting a lot of misinformation from, all sorts of different sources, GPs, nutritionists, the media. So could you maybe cover a little bit about what you mean when you're talking about metabolic syndrome? So, you're touching on heart disease, cancers, blood pressure, but can you just talk a little bit about how insulin gets involved in that and blood sugar regulation?
Yeah, certainly. So we have to do a little bit of biochemistry to understand what's going on. So I'll try to keep it very simple. When we eat, especially carbohydrates, now carbohydrates is one of the 3 macronutrients. So we have protein, fat, and carbohydrates, but especially if we eat carbohydrates, what's carbohydrates? It's sugar or any starchy material like potatoes, rice, and bread. All of those things in our body break down to glucose. So the body can't differentiate whether we're eating sugar or we're eating a potato. In the end, it all breaks down to glucose. When our blood sugar, which is glucose, rises after we've eaten carbohydrates, our pancreas secretes a hormone called insulin, because it needs to keep the glucose at a very tight range within the blood, but also insulin allows the glucose to move into our cells. And why is that important? Because our cells use glucose for energy. So that's insulin's response and function. But insulin has also got other functions, and a very important function is that it's a fat storage hormone. So if we eat an excess amount of carbohydrates, the extra glucose that's not used for energy production is deposited as fat in the body. And very typically, this fat is around our internal organs, and it's also in our waist area. So as soon as we see our waistline expands, we know that there's extra carbohydrates that's been turned into fat. Now, that's all good and well. I just want to mention that protein and fat don't elicit that high insulin response in the body. What happens if we keep on eating a high carbohydrate or carbohydrate-rich diet over months and years, our body starts excreting more and more insulin, trying to cope with all this glucose. Unfortunately, in time, our cells becomes resistant to the effect of insulin, meaning that the glucose can no longer come into our cells. So our cells and our tissues become deficient in energy. Basically, they don't have enough energy, although there's a lot of glucose in the blood and very high insulin levels. And that condition we call insulin resistance. And when it happens, when our muscles become insulin resistant, we call that disease type 2 diabetes. When in women our ovaries become insulin resistant, we call that polycystic ovary syndrome, and that's one of the most common reasons why women suffer from infertility. If our brain becomes resistant to the effects of insulin, we call the disease Alzheimer's disease. And many scientists these days now call Alzheimer's disease type 3 diabetes. So it's all linked in the background to this condition of insulin resistance that present in different disease endpoints. And you can have more than one of these, and we never know who's going to develop, say, high blood pressure, who's going to develop type 2 diabetes. If you've got a family history of type 2 diabetes, there's a great chance that you may also go that way if you don't amend your diet. So I'll stop there, Sue, just for some more questions or clarification.
Yeah, sure. So I've got a question that's come in for Issy, actually. So this, it might jump around a little bit. So Issy, the question for you is, how difficult did you find it making those changes?
I chuckle. It wasn't totally easy. I'm not saying it was. It became easier in time. But let me just rewind to sort of day one. I had been told for probably the best part of 30 years to eat low fat, be very careful about my fat intake. And so that was, it's a complete anathema to me. I was indoctrinated into the thought of low fat. So every time there was fat in the good fat, full fat yogurt, full fat cream in my recipe, I was resistant. It was probably just about as resistant as insulin resistance, but I was resistant. And I hesitate to use the word worried, but I did. I was concerned. you know, I'm eating so much fat. And I would mention this to Estrelita, and she said, keep going. and it took me, I'll be honest, it took me about 3 weeks to get over the idea. I didn't totally get over the idea in 3 weeks, but it became easier for me just to add the full fat product into the recipe. I wasn't resistant. And then within months, it became totally natural. And the effects, which perhaps we can discuss later, were enormous. And they were actually noticeable within weeks of by taking full fat products.
So as a non-medical person and being the guinea pig for this experiment, what were the things you were worried about with the fat? Was it cholesterol and heart disease? Was that your main concern?
It wasn't even that, to be honest with you. I hadn't really thought about it. It wasn't a medical reason. It was just the indoctrination process of being told to eat low fat. And that is the insidious message that is global now. You know, lower your fat content, lower your fat content. And if, you know, you do as a non-medical person, you actually, you do listen to medics. I did. And, you know, when they said that, I thought that was the truth. It was only when Estrelita had finished her research, I realized it wasn't the truth at all. And really for probably 30 years, I'd been following the wrong doctrine, which actually caused the health problems that arose.
Yeah.
Does that answer your question?
Yeah, that's great. Thank you. While we're on the topic of fat, I'm just going to throw a quick question out there. Can one or both of you talk about the different kinds of fats? Because that's so important. I think people are learning to not be as scared of fat now with keto. You know, there's so much keto and stuff around. So people are learning to use fat, but there are concerns about the different types of fat you use and how much. So if one of you would speak to that, that would be great.
Yes, I think fat is always a difficult polyunsaturated fats. And I think most people have heard those two terminologies already. Now, I remember very well, there was actually one discussion at medical school that I remember, and that was in our laboratory medicine lecture, where the professor got up and told us, well, you guys, you know, we always use saturated fat. That's no good. Things have changed. And the best thing now is to go for polyunsaturated fat, especially margarine. Now, imagine that. I can distinctly remember that. So out the butter went, in the margarine, you know, all the shops were selling it and everybody changed. Oh, it was so easy to spread it on the bread, you know, it's never hard, blah, blah, blah. So fast forward to today, we still have saturated fat. That's usually, you know, fat, we get that in animal products. Those were labeled in the past as being the bad fat. And then the polyunsaturated fat, and these, the names of these fats have got their basis in the chemical structure. So we're not going to go into those technical terms. But for polyunsaturated fats, we've basically got two groups. The one is the omega-3 polyunsaturated fats, and the other group is the omega-6 polyunsaturated fats. Now, the omega-3, want to start with that. That's the good fat. And why do we say so? Because it's a critical component in our cell membranes and also in our brain. Now, omega-3, there's a lot of supplements that's available to buy that, but it's important to know that there are 3 products of omega-3. The first one, ALA, is based in plant products. And it's a precursor to the 2 other omega-3 products that we as humans use. but the plant product doesn't convert very well to the forms that we need, which is EPA and DHA. So in order to get the very important omega-3s, we need to eat a lot of seafood. Oily fish are extremely good sources of omega-3, and we need it, our brains need it, we need it to be intelligent and for all the complicated brain functions. I'll now get to the problematic oils and fats, and that's the polyunsaturated omega-6 ones, because these oils and fats are man-made. And what this already started in the late 19th century, and especially in the 20th century, where products like corn, soybeans, sunflower, and all these vegetable sources are being used to produce oils, but they also go through a very heavy chemically modified. So these products have escalated, the usage of that's been escalated in the 20th and the 21st century. So it's almost completely replaced in cooking and eating things like butter, tallow, olive oil, coconut oil. And what comes to light now is that these polyunsaturated vegetable and seed oils are highly inflammatory. So they're not natural, they're man-made, and of course margarine squarely falls into that category as well. So the takeaway message from this is really, with regard to fat, eat what is normal, what comes from nature. Avoid completely the industrial produced polyunsaturated oil products. So yeah, butter, coconut oil, olive oil, those are very good sources of fat, and also all the saturated fats that we have in our animal products, animal protein products.
Fantastic explanation. Thank you. Izzy, I've got another question for you. The question is around, it took you 3 weeks, you said, to really adapt. What were the symptoms that you had? Did you suffer from constipation, and what did you do about it if you did?
I love 3-tiered questions. By the end of the answer, I've usually forgotten what the three points were, but don't you worry, because we know each other well enough, and I can come back to you.
So the first part was, what were the symptoms that you suffered?
Yeah. I didn't even, well, before I actually started on low carb keto, I actually didn't realize what the symptoms were. I just felt awful. But how I felt before I started was I had brain fog, although I actually wasn't able to identify that I had brain fog until it had lifted. Okay. I had heart palpitations, and actually my heart would temporarily stop for a few beats, which would cause me to faint. And I wasn't sleeping well. I had very sore muscles and sleeping at night. My muscles would cramp. That's what it felt like. And as I said, I wasn't sleeping well. I was pretty moody. But I would actually describe myself really as irritable. I could become quite irritable quite quickly. And life really wasn't good. Can you remember any other symptoms?
Well, and obviously the high blood pressure.
Oh yes, sorry, the high blood pressure I'd had for such a long time. Actually, it was actually becoming normal. So anyway, so that's where I was presenting. Within, I think probably about within a few days. Actually, I'm very energy conscious. So within a few days, I started to quote unquote feel better. What do I mean by that? I felt as if there was hope. Hope is very important actually when you're losing your health. I felt energized, slightly more energized. I mean, not instantly energized, but I felt slightly more energized. What I noticed was that I started to feel more creative. My brain started to work again. I think actually what had happened was my brain was actually going into its own version of lockdown. It was just shutting down. So within probably 2 or 3 weeks, the creativity had returned. I was sleeping better. I also take magnesium bisglycinate for my heart, which was recommended by a doctor friend of Estrelita's, and that perhaps helped with the sleeping, but by crikey, it helped with the cramps at night.
Yeah.
It really calmed things down, and I just week on week, I actually noticed that I felt better. I also felt, this is not a medical term, but more like it. I felt more like doing things. Before everything was an effort. Of course, I did it because you just get on with life. But actually, life became more joyful. I think that would be the best way to describe it. That was certainly in the first 3 weeks. Those are things that I noticed. A start. Now it wasn't the finish, but it was a start.
Sue, I know there was a question about constipation, and I know that not everybody, but some people suffer from that. And, there are various things that one can do about that, because very often people notice that there's a change in their stools, the frequency and so on, or the pattern changes. So that's all quite normal. I think what is very important is your fluid intake should be adequate. That helps. But one should also think about either taking some extra fiber, it could be soluble fiber, add that to your food, or what I find very effective is using seeds like linseed, and put that on top of your food when you eat. So magnesium, if you want to take a lot of magnesium, that can also help. So it's just various things that people need to try.
And
I just add to that point? Sorry, I'd actually forgotten that part of the question. See, I told you the 3-part questions are tricky. I have diverticular disease, so actually the constipation wasn't necessarily a challenge, but actually, just whilst I bring up that particular subject, that condition has completely calmed. I'm not saying I don't get the occasional little attack, but it's completely calmed being on low-carb keto, completely.
Oh, that's great. I was just going to add to that constipation. I think sometimes when you go low-carb keto, making sure that you're keeping your electrolytes up high enough is important. I don't know if you've got any thoughts about that, Estrelita. Yes. And salt,
Absolutely, because as your insulin falls, because that's what low-carb keto does, insulin keeps water and salt back in the body, and as your insulin levels drop, you lose a lot of water and salt. So always add extra salt. Now this comes to one of the other myths in medicine, that salt increases your blood pressure. It's not the salt, it's obviously the insulin resistance. So that sometimes take a bit of training to re-educate people and say, you can really add salt to your food, or eat extra salt, that may also help.
Thanks. And that just touches on another question I've got, which was about salt. And the question was the GP asked her to cut down on salt and protein due to her compromised kidney problem.
Sorry, so I'll have to ask you if you can read that again. I was just...
Not a problem. The question was about the GP had asked that salt and protein be reduced because of a compromised kidney?
Yeah, you know, there's a lot of belief that you know, one can't eat protein because it's going to affect your kidney function and so on. One will have to understand what the condition is, and you know, there are various laboratory tests that one can do to monitor kidney function. Personally, I don't think that going on a keto diet will affect that. There has been studies done to look at this very issue, and there's nothing that I've seen that indicate that this type of diet actually has a detrimental effect on kidney function. Actually, the reverse is quite true. So what I would say is follow the diet and monitor the situation. There are, as I say, very good laboratory markers to look for kidney function. And I wouldn't just outright accept that, but rather monitor the situation. And I'm sure that you know, there won't be any problems.
Yes, this lady, she's just sent through another message saying, and I've worked with her for quite a while now, and she's saying, having met Sue, I've doubled my protein and trebled my salt and had no kidney pain for 12 months. And
absolutely.
That is absolutely fantastic. Well done to you both.
And she came off, you know, we got her blood pressure down by exactly what you've just been talking about, Estrelita, lowering those carbs, getting that insulin under control. So, right, we've got a few more questions here. So we've got a question, if we're eating well with low carb, high fat, or low carb, healthy fat, as I like to say, should we need supplements?
You want to go?
Well, I think that if we eat good quality food and fresh food, that it should be adequate for our needs. But there may be, if it also depends on, you know, there's a lot of essential vitamins and minerals that's much higher in certain types of food. So for instance, we've already spoken about it, fish and shellfish and so on has got very high levels of, you know, fat soluble vitamins, the omega-3s, and some essential minerals like zinc and iron and so on. So it depends on what we eat. If we restrict any of the categories of say animal proteins and so on, there may be a reason why we need to add some supplements, and those would be especially I'm thinking about vitamin D, vitamin A, and omega-3. So
and maybe magnesium.
And magnesium,
yeah,
magnesium specifically for muscle function, and especially if you've got any symptoms like muscle cramps and so on, it's always good to add that. So it's not a no. Actually, one can encourage people to take specific items where their diet is maybe not sufficient.
And I think it might be helpful. I just to say what I take omega-3. I just take some extra omega-3. I take magnesium bisglycinate, as I said, for muscles. It's made such a difference, and vitamin D. Not that we don't have sun here, but we don't have enough.
Yeah, and you know, we're all conscious about covering up and sunburn and things like that as well. So
yeah, that's quite an interesting point, Susan, because what I've noticed is that I don't suffer so much from sunburn any longer. And it's quite noticeable because I was very, very sensitive to sunlight and easily got sunburned, but it's no longer the case. And I know that other people have experienced something similar.
Yeah, I think there's quite a bit of research out there showing if you reduce the feed oils, those omega-6s that you were talking about, that can have quite a significant impact in reducing sunburn. Right, I have another question. So this might be one that you could both answer perhaps. Any tips for hot flushes?
Yeah, good question. Actually, I'm preparing, it's very timely, I'm preparing to give a menopause lecture here in Edinburgh in a couple of weeks' time. So menopause is a very interesting topic, and I didn't realize it until fairly recently. But if we look at traditional societies, women in traditional societies, and I'm thinking about, you know, the Maori women, for instance, in New Zealand. I'm thinking about the Cree women in Canada, the Native Americans. I'm thinking about women in Africa and traditional societies like the Zulu, the Swazi, the Hadza. You know, they were traditionally hunter-gatherers societies, and research has been done. I mean, they don't all live, or very few of them live in their traditional way. But research shows that these women don't have a term for menopause. It doesn't exist in their language. They only experience it is there's a change from, there's, they don't bleed any longer. But the typical Western symptoms of a lot of hot flushes and, you know, the weight issues, the sleeplessness, the mood changes, those are not recorded as being problems in traditional society. So one starts to think, you know, we were always taught that all those symptoms are associated with a decrease in the amount of estrogen. And that's why women take HRT to try to boost the estrogen so that you can reduce the symptoms. But actually, if one thinks about it, the time when we go through menopause is really between, say, 40 to 60 years, somewhere in that range. But something else is happening at the same time, because that's exactly the time when these lifestyle diseases present as well, usually between 40 and 60 years. And interestingly, that's also a hormonal disturbance, because we've spoken about insulin. But if you look at the hormones in our body, insulin is the dominant hormone. So if insulin is high, it will dictate what happens in your body and what we experience. So it's less about the estrogen and all the other sex hormones. It's more about the insulin. So if you live with high insulin, you're trying to correct whatever it is about your sex hormones, it's not going to be very effective, because the effects of insulin dominate. So in that situation, you have to address the insulin first. Otherwise, you will have very little impact, or not completely be able to alleviate your so-called menopausal symptoms. Does that make sense?
Yeah, absolutely. And I did a research project when I was doing my master's degree just on that topic as well. So it's great that you're talking about that. And as a result of that research, I made some decisions about my own lifestyle. So looking back, I probably kept my insulin very low. The other thing I did was I ate sufficient protein. I made sure I kept a good protein intake, and I did strength training exercises as well. And I've been absolutely blessed that I have had no menopausal symptoms at all. And I just feel I was so fortunate to, oh, you've disappeared. I was so fortunate to have done that research. Are you still there?
We're here.
No? Oh, there we go. We lost your video for a minute. All right, we've got some more questions. Is there a recommended limit on how many eggs people should eat? What about cholesterol levels in eggs? Should we worry?
Well, I don't think so. I mean, I have a friend who sometimes ate 6 to 8 eggs per day, and perfectly healthy, very good source of protein. So I know eggs were one of the items in the past that's been put on the list. Don't eat more than, can't remember even, was it 5 eggs a week or whatever. Very, very good source of protein. So I don't think there's any problem with eggs. And with regard to cholesterol, that's another topic that we can chat about, because cholesterol per se is a very important component of all our cells. It's a component of our cell membranes. It's the basis for many hormones, our sex hormones, vitamin D, bile salts. Cholesterol in the brain plays very important functions. So cholesterol is an essential part of us. Even in mother's breast milk, cholesterol has got very high concentrations. So the stigmatization of cholesterol is another problem, because it's been associated with heart disease. Saturated fat and cholesterols in the 1950s. Ansel Keys told everybody that that's the cause of heart disease without any evidence. And they've tried through the years to prove that with many, many different studies involving thousands and thousands of people, and they've not been able to do it. And unfortunately, we now have a lot of statins, which has been developed by the pharmaceutical industry trying to lower cholesterol. It's a $1 trillion business, and it's got its own momentum in keeping people afraid of cholesterol and that you need to lower it. And we even know that there are protocols for GP practices that if people's cholesterol goes higher than a certain level, that they need to put their patients on statins. So this is driven by the pharmaceutical industry, and it's got serious side effects as well. I would say the majority of people don't need those. And actually, the cholesterol that may be damaging is actually cholesterol that's been changed by our sugar intake. It's not, in the normal physiology, cholesterol is not a problem.
Thanks for that. And you and I, after the last podcast that we did together, we had a bit of a chat about my high cholesterol, and you were, I don't take a statin and I don't believe it's dangerous. I won't know, I guess, but you were very reassuring and reassured me that I should be fine, because all those other markers are nice and good and low and in good ranges.
What I can say to people that had a high cholesterol test, the most important marker to look on your laboratory report is look at your triglyceride level. Because if your triglyceride level is high, that's an indication that your fat is too high. But that comes from glucose metabolism. So that's the very important mark. There are a couple of other markers as well that one need to look at. For instance, your liver markers, your liver enzyme markers. You don't want those to be very high, because it also shows that there's fat in the liver. But all of those markers are linked to carbohydrate metabolism and not to cholesterol metabolism. This is unfortunately not realized by a lot of GPs, that just kind of go through the mill and tell people there's a good and a bad cholesterol, which is really not the complete story at all.
Thank you for that, and well worth mentioning those triglycerides. And that brings me to another question I've got here, which is about high triglycerides. So this lady had her gallbladder removed and she has lost quite a lot of weight. She is under a keto doctor's care, so she's under medical care and she's doing keto, low carb under a doctor's supervision. But her triglycerides have become so elevated, they're very dangerous, and she's asking, do I need to eat less fatty protein?
It's quite difficult to answer without understanding exactly, what she's eating, and what her daily carb intake for instance.
I think she's on a zero carb diet.
Yeah, I must say, you've got me a bit speechless there.
I was wondering with the weight loss, because we know that weight loss in the early stages will drive triglycerides. So I did wonder if that could be part of the problem.
How long has she been on this program?
I think it's a couple of months and she's still losing weight.
Yeah. I mean, it would be interested, I would be interested to know
3 months. 3
Yeah.
months been on the program.
I would be interested to see the other markers as well. For instance, a lipid profile and so on, and also to see what it was previously before she started, because it is a process. It's not going to normalize immediately. Some of these markers can take much longer to normalize. We know that, for instance, liver enzymes change much quicker. So it could be that she's just in the process of changing these markers. So I wouldn't stop now, but say on a 3-monthly basis, repeat testing. And let's have I always look at the history before, if they have any markers before they start, 3 months, 6 months, and follow up the changes.
Great. And I guess my question about that, for myself working with people who have had their gallbladder removed, what are the thoughts, or are there any sort of contraindications for higher fat when you don't have a gallbladder?
Well, I think that it's also what they can tolerate. How do they feel, when they eat, fat or protein? How do they feel? I think that's important. What have you found, Sue, with people with a gallbladder removed? Have you seen that they have more problems with fat?
I find in the initial stages, quite often they will, and some of that I think is that they don't have they haven't got the enzymes to sort of digest and process fat. And over time, I find they do improve. And I tend to start them with a little bit lower fat and give them some time to adapt and adjust. And then over time, slowly increase the fat. And I do find different people respond differently to different fats as well. So some people seem to do quite well with, say, coconut oil, but they won't do quite so well with sort of lard or beef fat or mutton fat. And some people do quite well with butter, but not with other fats. So
I think that sounds like a very, very good approach, because we know that everybody doesn't respond exactly in the same way. And especially if they've had a condition like that, to take it step by step, try different things, as long as you stay within the group of good fats, and try different things, see what's suitable and adapt the diet in that way.
I also use digestive enzymes a little bit as well, sometimes even in people when they're just first starting, because often their digestive, especially their stomach acidity is a bit low. So I might add some HCl with some betaine and pepsin, and maybe some fat digestive enzymes as well, just to assist, and then hopefully we phase those out over time.
Yeah.
Okay. Another question. So, been LCHF for 12 months now, when would I hope to see improvements with the hot flushes?
Can I just say something else actually about the hot flushes? Is that when before I knew anything about low carb ketone, low carb healthy fats, I did go through the menopause. It didn't seem to be that bad, but for the hot flushes, I was recommended sage tea, which has a slightly unusual taste, much improved by adding mint. But I was able to actually overcome my distaste for the taste, and actually I found that actually helped quite a lot. It's just just infuse some sage in water, and if you really don't like the taste, add mint.
Oh, thanks for that little tip there, Issy.
Yeah, just getting back to the hot flushes, I think that one thing that one can do is to monitor one's insulin levels, because that's really what you want to get down, to know that you are that your body will respond to this in the right way, because if you can get your insulin down to a good level, these are the menopausal symptoms should be better. I'm not saying that you're never, ever going to have a hot flush again, but I think one need to make sure that you are getting the insulin resistance markers down. If you're still getting hot flushes, I think one needs to just, review if there's anything else that one can do to improve. On the specific elements of the diet that you're following. Maybe do some lab markers and just check that. That's what my advice would be.
Great. I've got a couple of questions there, or a comment and a question myself. So what do you think about stress and cortisol in terms of promoting insulin resistance, even when the diet is much improved, or is a low carb diet? Do you think that could be contributing?
Yeah, I mean, stress definitely is linked to increase in insulin as well. Chronic stress definitely a factor, and I think one needs to look at this more holistically. So obviously the diet is critical, and I would say that is probably the most important thing to start with. But there are other elements, and you've mentioned exercise, for instance. By exercise alone, you're not going to reverse a bad diet. We know that. You have to do the exercise in conjunction with the diet. But there are other factors as well. If there are stresses in somebody's life, it can still fuel some of that insulin resistance if you can't remove that element. And I think this is important, because it also goes with your sleep pattern, and it's a few elements. You need to try to see what is the cause of the stress and being uncomfortable in your life, and what one can do about it, because it can have a very negative effect if you cannot alleviate or do something about the stressful situation. Sometimes it's difficult to identify what the stresses are, and that may need a little bit of counseling and working through to identify that, and then see if there are practical changes that one can make to take away some of that stress. So very important.
And I think another thing maybe worth mentioning, without getting too biochemically complicated, is that our visceral fat has very high receptor density for cortisol and for insulin. So that's where it's going to really impact us. It'll impact us in that visceral fat around our tummy. And then, of course, we know that those fat cells then will increase estrogen production and other cytokines, so other inflammatory markers. And so then we kind of have this, complicated cycle going on as well.
Yeah.
And I think finding strategies to cope with stress is really important. Another question, should alcohol be limited? Your laugh.
Don't we love it? I'm a true Scot, and yes, I enjoy alcohol. However, my answer would be tempered. When I first started low carb healthy fats, I stopped all alcohol, principally because I wanted to see if this really worked, and I thought, well, there's no point in drinking because it's going to skew whatever results I have. So fast forward, it doesn't mean that I don't actually enjoy a glass of wine. Far from it, but I have limited alcohol. I think we find two reasons in people that we work with. One is you can still be low carb actually and have a glass of wine. The problem is that when you've had a glass, then there's usually actually you want two. And then one makes incorrect food decisions because it's, you're less inhibited and you eat the wrong things. And then you actually count up your carbs and you discover you're way over your limit. So we recommend sort of not abstinence, but just be careful, actually. And especially if you're wanting to lose weight quite rapidly, don't.
Yeah.
Do you want to say that?
I think if you're just starting out and maybe you've got some health issues and you want to see if this diet will help you, I would advise people to cut out the alcohol, because you really want to go low carb to try to get the insulin levels down. And say after 3 months, if you're able to make health progress and you've stabilized, one can reconsider and maybe carefully introduce, but it needs to be, one needs to be careful about that, because you can lose it so quickly. So there is some discipline, but it's not to say you can never have it. It, once again, as we've spoken about, it's that individual thing and how you manage that.
Excellent. Getting back to blood tests, I've just got a question, and that came up from your previous answer as well, as about getting some getting some labs done to monitor your progress. So this is a question from one of my clients, and to be honest, in the last week, I've had 3 doctors ring me about this. The doctors, I've recommended some blood tests with some clients, and the doctors have all refused those tests. They don't understand why I want to check insulin. And I also, being a nutritionist, I look at quite a lot of nutritional markers like vitamin B12 and 6, and I look at the omega-6 and omega-3 ratios and things like that. And these doctors have rung up and said, I don't understand, what are these tests for? Why are you doing?
Yes.
Why do you want to do them?
Well, so I think the most important test for me is the fasting insulin test, because you need fasting insulin and fasting glucose to be able to do a lot of the calculations that we do. And the doctors don't understand, because I didn't understand previously why insulin, because you've got glucose. They don't understand that diabetes is basically hyperinsulinemia. They don't understand it. They just understand it's glucose. They don't even know about the high level of insulin. I don't want to be unkind, but maybe they need to read our book that explains what insulin.
I was thinking that I might send them all a copy of this video to start off with, And then
Yeah.
some of them have asked me for research, so I will do that. But you know, it is a challenging situation without being disrespectful, because I really have a huge amount of respect for doctors and their knowledge and their skill.
And you know, Sue, and that's really one of the reasons why I've written the book, is also hopefully that patients will introduce the book to their GPs, because it's not that they don't want to know. I mean, some of them may be more resistant, but it's also having the time to, doctors in a busy GP practice don't have the time to delve into nutrition the way I did. So this was really to have something there that they can understand, not too difficult, and make sense from a medical perspective. It's a lack of information, and it's how we educate them, because it's not going to happen in the official you know, medical societies and so on, because the pharmaceutical industry has got too much of an impact and a hold on those to want to have this information infiltrate. So it's something that we need to think how to do, and maybe find GPs that's open to look at a different point of view and help them understand. That's what we see here in the UK. People like, you know, Dr. David Unwin had to fight in his practice with his colleagues because they didn't believe him. So you need a few key people that's willing to listen, to start doing something. I mean, if they're open to listen, you know, one should try to talk to them and send them information, ask them what they're prepared to look at to help them understand.
Thank you for that. And again, I just want to say how grateful I am that we have, you know, you make yourself so available to us, and that you're on our team, and, you know, backing it all up with science, you know, so it's, you know, out of the doctor's mouth, you know, which I think is quite important.
We all, you know, play a role, and I'm happy if I can help in any way.
Thank you very much. We're getting close. Well, we're just over 8 o'clock. So I'll just see if there are any last questions. There's one here about fat and pancreatitis and the recommended diet of being low fat.
Yeah, pancreatitis. Yeah, I think once again for pancreatitis, one needs to see what else there is in the diet, you know, because the food itself is not going to cause pancreatitis. I mean, the food that we're talking about as real food in a low-carb, healthy fat diet, that's not going to cause pancreatitis. There must be another cause for the pancreatitis.
Okay, and does a high carb diet, will that, you know, like the fat, you know, the carbs being converted to triglycerides in the liver, and, you know, would that contribute to pancreatitis?
Well, the most important thing that one needs to eliminate is obviously, you know, alcohol usage, because that is most commonly associated with pancreatitis. I honestly, you know, obviously with insulin resistance, there may be effects in the pancreas as well.
So probably speculating there, but yeah, the alcohol use, excellent point. And so the question is, no alcohol, idiopathic pancreatitis.
Yeah. Honestly, I don't have an answer for that. I think once again, one will have to have a much better overall assessment of, you know, what's going on, and medical history and so on.
Excellent. All right. Well, I think I'll just check my I'll just check my phone as well for messages. And I've got a last comment. It's been a privilege listening to you three impressive women. Thank you. Hope we can do it again.
Well, we hope we can do it again, and we're so respectful, Sue, of what you're doing in New Zealand, and we're also very grateful to you for your help when I seek it. So thank you very much.
It's a pleasure, and it's been such a joy to connect with you both and share your work and your books. So would you like to just, for the people who came in a bit late, would you like to just recap perhaps a little bit about your books that you've got available and your health program that you've got available, and then we can wrap it up?
Sure. Do you want to go?
Yeah, so we can maybe just show for the people that hasn't seen our first book, Eat Well or Die Slowly. This is the book with all the basic medical information in it, the one I recommend for patients as well as doctors, just with a summary. So it's not a very thick book, as you can see. All the books are available on Amazon. This is our first recipe book. It's a general one. So it's got a wide variety of low-carb recipes. And then more recently, we were asked to do a vegetarian recipe book. So we've combined that with seafood, and they all give the individual carb values so that it helps them with their planning their day. And then we have an optimizer plan for new people that would like to know how to approach this on our website. It's just wellnesseq.net, and there's a lot of information that they can find there.
Thank you. And when I send the recording out in the email, I'll make sure that I put all those links and things in there for you. So, yep, lots of people saying thank you very much. Really appreciate your time and wonderful information. So thank you.
Thank you, Sue.
Well, thank you for inviting us. We've really enjoyed it, as always.
Even though I got you out of bed at ungodly.
Well, listen, I wasn't going to mention it, but seeing you have mentioned it, it's light here now. We don't have to have the lights on.
Excellent.
Anyway, thank you for all the great questions from you and from the listeners. It's been great chatting to you all.
Thank you.